Okay, we're going to get started now. Welcome to the first System of Care Expansion Leadership Learning Community webinar for this fiscal year. This webinar is brought to you by the TA Network. The TA Network hosts the National Technical Assistance Center for SAMHSA, for Children's Behavioral Health, for the System of Care Grant Program. With me today is Beth Struhl. She co-leads this learning community with me. Beth, you want to say hello?
Hi, everybody. Welcome.
Along with Beth, and I'm sure if you don't know her already, you will know her through the literature. She is often cited with system of care work. Also, we have with us Emily Lickvar. She is a government project officer at SAMHSA, and she'll be presenting as well. Emily, you want to say hello?
Thanks, Denise. Hi, everyone. Great to be here today.
So what we'd like to do is really encourage you guys to use the chat box. We are able to open the lines if folks are comfortable asking questions, but we will try to answer your questions in the chat box as we go along. We will also read some of your questions out loud for further discussion. Our objective for today is to really provide you with an overview of the 2016 System of Care Expansion Cooperative Agreements. We're going to go over roles and requirements, context and framework, and technical assistance supports and resources. So with that, we're going to just start with going over the cooperative agreement itself, the program roles and requirements, and Emily's going to start us off.
Thanks, Denise. Hello, everyone. We're going to go over program roles and requirements. Having difficulty switching to the next slide. Let's see. There we go. Okay. So in these next couple of slides, we're going to be going over the role of the Government Project Officer, the Division of Grants Management, and also Payment Management Services. We're also going to cover special terms and conditions on your Notice of Award, or also known as the NOAA. We're going to go over actions that require prior approval. We're going to go over the process for requesting prior approval. We're going to go over reporting requirements. And we're also going to go over SAMHSA Grants, the SAMHSA Grants Management website. Oh, so that does work. Okay. Here's just a visual. So here, the grantee is the recipient, and there are kind of three prongs at the SAMHSA level. The Government Project Officer, your Grants Management Specialist, and then also the Payment Management Services Representative. So we're going to be going over all three of those SAMHSA level prongs that work together to help you, the grantee, or the recipient, implement your program. Starting with the Government Project Officer, also known as your GPO. The GPO is responsible for the programmatic and the technical aspects of their grant. So the GPO is really the liaison between you, the recipient, the grantee, and SAMHSA for all the programmatic and technical aspects. And we work in partnership with your grant management specialist throughout the duration of the grant cycle. The role of the GPO is to manage the programmatic aspects of the grant, such as the following. We provide guidance on achieving project objectives, help with the strategic planning. We engage in problem solving with the grantee. We respond to concerns and the needs of you, the grantee. We can help identify technical assistance needs. We coordinate and collaborate with partners and contractors, both on our end and on your end. We can help connect the peers and resources. And we often participate in regular grantee conference calls. The GPO's role also includes monitoring progress and compliance of your cooperative agreement. We review all progress reports and evaluation data. We provide feedback to grantees. We conduct site visits, which is one throughout the grant cycle, usually done in year 3. We approve key personnel, and if there's any changes to key personnel. We recommend approval to grants management for requests of budget revisions, change in the scope of work, continuation applications, and no-cost extensions, and really anything else that really might come up in terms of working with you, the GPO, and your grants management specialist. So these are the CMHI requirements for your cohort for 2016 grants. We're just going to go over them kind of line by line and the delivery schedule for each requirement. The first one is the Behavioral Health Disparities Impact Statement, and this is due soon. It's due November 30th. My screen is black right now.
My screen is black as well. Colin is bringing it on. Something about the grant requirements made the whole screen go black.
Got it. Are we back?
We are back.
All right. So the next requirement is program reports. Program reports, or also known as progress reports, are semi-annual. They are due, the first progress report is due 30 days after the end of the federal fiscal year on October 30th, and the second progress report is accepted as your continuation application. So you are only actually writing one kind of official progress report for the one that's the October 30th date. The other progress report is essentially your continuation application. That is standing for the other. We accept the continuation application as the other programmatic or progress report. Service delivery is another requirement for the 2016 grantees. Services should begin by 6 months after the award. So we're looking at April of 2017 is when services should begin. In terms of annual meetings, you're required to send a minimum of 10 people from your grant to at least one meeting per year. The infrastructure development, prevention, and mental health promotion indicators, these are also known as IPP indicators. You'll hear a lot about those. Those are to be submitted to the track data entry system quarterly. And there are several other track webinars that are currently being run this month for you guys. You should have received several emails from WestDAT Track to be a part of those webinars. But so IPP indicator data is to be entered quarterly for the IPP program level data. The social marketing plan, that is due by the end of year 1. Your finance plan, that is due by the end of year 2. Your FFR, your first FFR will be due December of 2017. That's Federal Financial Report, FFR, is basically your report of how federal funds were used in that fiscal year. So your first FFR will be due in December of 2017, and I believe that's 90 days after the close of the federal fiscal year. So you will not be turning one in this year because we have not had one federal fiscal year yet. We're only in, month 2 or 3 at this point. Services performance measures. Now, this is also known as NOMS data. NOMS stands for National Outcome Measures. That is the client level data. Those are the interviews that you're conducting with clients served. Those, you will start collecting that data when you start services. Again, that should be right around April. Services performance measures are also known as NOMS data. You will be entering NOMS data into the track system. So into the track system is going IPP indicator data and also the NOMS client level data. Also into the track system will be your annual goals and budget information, which is entered in there yearly. And again, you should be getting all of that in your WestDAT Track webinars that are being launched this month. If you've not received information on that, please contact your GPO and they can connect you with those training dates. The final requirement is participation in the national evaluation. And you want to see information from the national evaluation team You should have been contacted at this point by your National Evaluation Liaison, and the contractor that is leading the National Evaluation is WESTAT. Right, time to click here. Okay, so in summary, your GPO will work closely with you, the grantee, to strategize and provide programmatic guidance. Our technical assistance contractor to help you access training and resources, our evaluation contractor to help you monitor your progress towards goals, and your grant management specialist to be sure that fiscal and grant compliance issues are addressed. So in sum, the role of the GPO, we really can kind of help you get the information that you need from all of these kind of different, areas of the grant. You can always come to your GPO and we can, with any question, and we can direct you to the right place. Or we can answer your question. If we don't have the answer to the question, we can, of course, find the information for you. These are all the GPOs in our branch, I believe listed in alphabetical order. We look forward to working with you. I hope some of my grantees are watching the webinar right now. Very exciting. All right, we're now moving on to kind of the role of the grant management specialist. For all CMHI grantees, Gwen Simpson is your grant management specialist. This is her contact information. Email is definitely the best way to reach her. So the role of the grant management specialist is to partner with the GPO, and they are also responsible for the business and financial management matters. This includes award negotiations, official signatory for obligation of federal funds, official signatory for prior approvals. They monitor fiscal and compliance issues, and also the closeout of the grant. The payment management services role. So this is kind of the third prong of the SAMHSA level arms that you'll be involved with throughout the duration of your grant. So the payment management services role is to the drawdown of funds is made through the payment management services system. This is the website to access the PMS. If there are questions about that, you can always email your GPO or your grants management specialist. If you're not sure who to go to, the GPO, the grants management specialist, you can always just go to the GPO and we'll kind of direct you furthermore, just so you know. Okay, so now moving on to special terms and conditions on your notice of award. The notice of award is pretty much the contract that you have with the federal government. So even though some of the jargon in the notice of award might be a little bit hard to understand, it's very important to pay attention to what's in there. If you have questions about anything that's in the notice of award, I strongly encourage you to talk to your GPO and or your grant management specialist, just so you're very clear about what is expected of you, because that really is the contract. The NOAA is really the contract in terms of what is expected of you. So all of the stuff that we're going over, all these requirements, these are in the notice of award. So special terms and conditions. Pay attention to the remarks, special terms and conditions in your notice of award. Here are some of the things that are in there. Due date. Due date, response to participant protection concerns from the reviewer. This would be something you would address very early on, if not have already addressed. Response to marginal or inadequate scores from the reviewers. Again, same thing. This would be response to grant management requests. It would be a response to program requests. And it would also be the submission of progress reports and FFR, also known as the FF 425. They're both. That's what it is. The form number. Okay, so now we're going to go through some actions that require prior approval. If you have any question, throughout the duration of your grant, you're not sure if this requires approval. Again, I strongly encourage you to reach out to your GPO and they can tell you whether or not something requires approval. We don't expect you to have this stuff memorized. Please feel free to reach out to us for any information that you need along the way. So the first thing that requires prior approval is key staff changes. So any replacement or substantial reduction in effort of the program director or other key staff require prior approval. Now, if you're wondering who are key staff, how do I know? Is it just the project director? Is it the PI? Is it anyone else that I'm hiring or firing? If you look in your notice of award, whatever name is in there, because what we're doing when we are making it an official change, we're actually generating a new notice of award. So that should be kind of your litmus test in terms of deciding whether this person is a key staff and whether it requires prior approval. You want to see who's listed in that notice of award, and that means they would require prior approval for a change, because when that person changes, we then need to generate a new notice of award. And there is a procedure. There are several procedural steps in terms of a letter, a budget revision. There are certain steps that you'll need to do to make the key staff change, and you'll do that with your GPO. So make sure you contact your GPO. This is something that requires prior approval. The next thing is rebudgeting of funds. And this rebudgeting of funds requires prior approval when the cumulative amount of transfers among direct or indirect cost categories exceed 25% of the total amount, or $250,000, or whichever is less. So again, if you're not sure whether something requires the rebudgeting of funds, I would talk to your GPO about this. The transfer of substantive programmatic work to a contractor requires prior approval. The carryover of unobligated funds above 10% of the total federal share of the current budget period would require prior approval. This would be known as a carryover request. Another thing that requires prior approval is a change in scope. This would be the reduction in services originally proposed or the reduction in number of clients served. Again, changes in scope, there's a lot of gray area here. So this would be something that you would discuss with your GPO, and you would determine together whether this is a change in scope or it's not a change in scope. That would be something that you would discuss with your GPO. Finally, a no-cost extension. This would be to permit an orderly phase-out of a project or a program that is occurring at the end of the project period. This would be something that does require prior approval. The process for requesting prior approval. Requests should be submitted via email by you, the grantee, to the grants management specialist and the GPO. We're going to need to have all of this in writing. This would be stuff that would be uploaded to your official file. So it's very important that we have everything in a nice email to both Gwen Simpson and to the GPO. Even if there was a phone conversation that occurred, you want to make sure that it's written out very clearly so both Gwen Simpson and the GPO can, if they discuss it, the two of them, without you there, they need to really kind of see what the request is, so they have all the information there to kind of determine whether it's going to be approved or not, and this is something that would indeed go in your official file. So here you want to put this request in the form of an email to both the grant management specialist and the GPO. You always, always, always want to put your grant number in the subject line when you are interacting with grant management. Now, whether your GPO prefers this or not is something that you can determine with them, but since the grant management specialist is dealing with so many different requests from a variety of programs, you always want to make sure that your grant number is included in the subject line. That way they can just kind of like pull up your official file by the grant number, and they can kind of look, see what you're asking and what's actually in your official file. So it's very important. They oftentimes won't even answer your questions until they have your grant number, just so they can kind of, they need to open your file when you're asking the question. So please be aware of that. You also want to provide programmatic and budget justification when you are asking or requesting for approval for these kinds of things. And you also would want to have you and your business official CC'd on that email. These requests would be reviewed by both the grants management specialist and your GPO. Oftentimes, these conversations with you and your GPO will occur before you really put anything, in writing officially. That's very common. And oftentimes, with these official changes, a new notice of award will be generated. So that's why it needs to be official and so on and so forth, is because we actually are changing, the contract you have with us. So it would generate a new NOAA. Okay, so reporting requirements. Okay, so quarterly programmatic progress reports. Now, I know that we said reports are to be submitted twice a year, one as your continuation application and the other as your progress report. However, if your grant is forward funded, that means that you received all funding for all 4 years up front. That's what forward funded means. You are required, as delineated in your notice of award, that you're submitting quarterly programmatic progress reports. This would apply to you. It would be your responsibility to generate these quarterly progress reports, and you would need to send them quarterly to your GPO and to your grant management specialist. For more information on that, in terms of templates, in terms of the timeline for that, you would want to contact your GPO and discuss this with them immediately if you're a forward-funded grant. If you're not sure if you're a forward-funded grant, again, you want to get in contact with your GPO immediately so you know whether or not you are a forward-funded grant. These quarterly programmatic progress reports, this is something that usually is written in all notice of award, so sometimes you might think that this applies to you, but it actually doesn't. This only applies to grantees that were forward funded. So that's something that you would definitely need to know up front. The second thing is the quarterly federal cash transaction report. This would be sent through the payment management services. It's submitted online. And finally, the FFR, which we've already talked about. This is submitted to your grant management specialist. And you will not be worrying about this until December of 2017. Everything you need to know about managing a grant can be found at this link. Oftentimes when grantees ask questions to both their GPO and to the grant management specialist, we'll usually answer your questions, just like in plain English. I always try to. However, oftentimes we will include a link that shows you where on the grant management website you can find this information. The reason we do that is so you can use the website as a tool to really answer your own questions. You're more than welcome to reach out to us, but oftentimes the website will provide you with more details, a more technical, nuanced, all the nitty-gritty technical stuff that you kind of want, you can find on the website, including like templates and stuff like that. So it's a really good idea to become familiar with kind of the grant management link, and there's all different kinds of things that you might ask questions about: continuation application, FFR, carryover request, no cost extension, grant closeout, budget revision, all the things or change in scope, all of these different things that inevitably one of these things will come up. All of that information is found on the SAMHSA website. So it's very common that we will always direct you with the appropriate link to find the information.
Great.
All right.
Thank you,
I will
Emily.
transition to Beth.
Actually, we have a couple questions for you. One question, Emily, was about the meeting and training requirement, and I did let Randy know in the chat box that I'll be going over some opportunities that are going to be available through the TA network. But could you also let everyone know what the process is for getting other meetings and trainings approved as satisfying this requirement? Thank you.
Absolutely. Yeah. So yeah, the TA network, they'll have a bunch of different opportunities for the grantees. But if you find something that's outside of the TA network that's relevant to your program, what you would do is you would email your GPO, we ask that you send kind of the link to the conference or the training or something that kind of can give the GPO a little bit more information, and they'll either approve it or they won't approve it.
Great. Thanks, Emily. We also, through the TA Telegram that goes out on Monday, and I'll have a commercial pitch for that in a little bit, every now and then there are national meetings. We had the Federation of Families meeting last week in Phoenix. That meeting is approved by SAMHSA to satisfy the meeting requirement. Similarly, the annual Research and Training Conference in Tampa, hosted by USF, that's another one. But we always put in the Telegram when these national meetings are approved by SAMHSA as counting towards the meeting requirement. And your GPO is very, very accommodating and will respond to those emails. I think, Emily, it was your grantee last week, I believe, where they were attending a training in Georgetown, in the D.C. area. It was related to juvenile justice. It related to their grant purpose, and you approved that as a training.
Yes.
So that's the type of thing to just keep your eye open for. There was another question about when detailed guidance would be coming out in a document. And I believe you may have answered most of that question for Mary later on in your presentation when you referenced the notice of awards. Do you have any other guidance as to where they can find detailed information on due dates and requirements and other guidance?
Yeah, so I'm sorry, I'm trying to see where it's written out. You mean in terms of like a master calendar or something like that?
The website, all we got.
Is that the question?
I'm seeing if Mary is going to be typing in. Her question originally was, when will we be receiving detailed guidance documents?
So there are no detailed guidance documents, really. In terms of, so for example, so this doesn't really pertain to you guys because you're not doing an FFR or a carryover right now, but grantees that are in, years beyond year one, they recently received from grant management a PDF on kind of it was a several-page PDF that went out to all grantees that really was giving them all the appropriate links and due dates for both of those things, that really kind of delineated in a very detailed way where they can find information on both of those things and how they would submit them. That came from grant management to the grantee, to the business official. So it was emailed literally from grant management office to the business official of the project. That I would say that's how it occurs, or you can always look on the SAMHSA website, or if there are questions about specific dates and deadlines, you can talk to your GPO. But Mary, if you go back to the one slide that's earlier in the presentation, this one, right here, these are a lot of the dates for a lot of the requirements. I don't know if you had questions about other specific requirements you were concerned about, but these are the dates for a lot of them. But I would say the SAMHSA, go ahead.
Yeah, and what I was going to say, Mary, and adding to what Emily is saying, is the whole purpose, one of the main purposes of this learning community is to give you a support network. So Beth and I are here with you guys every step of the way. We provide you the technical assistance, support, and resources to help you meet your grant objectives, but also, and perhaps more importantly, to help you design, develop, and implement a system of care that can be expanded and sustained. So we will have continuing webinars on different components of your cooperative agreement. For example, in December, we're going to have folks from WestStat, from both TRAC and the National Evaluation, join us to help answer questions about those requirements. So stick with us. We'll be happy to help you, and when in doubt, you ask your GPO. Emily, we have another question about, there was a few questions in the chat box about when the first progress report is going to be due. It's not October 30th of this year, since they were just awarded, at least for the 2016 grantees.
Yep.
Has grants management sent out a notice yet saying when the continuing applications are due this fiscal year? Someone has 130. Okay.
They have not. They have not released that date yet, but it has historically been in February, March.
Okay.
So kind of sit tight for the continuation application due date.
And so, Jackie, what we will do also, again, in the Telegram, is we'll remind folks, as well as your lead consultants that's working with you and your grantee will also remind you when we see that the continuing application date has been released, and we'll remind you that that's when your progress report is due as well, as part of that application. Emily, we also have a question from Randy. He says it's a really general question. Under what circumstances are SAMHSA folks free to speak with their contractors as opposed to the grantee recipient organization?
Oh, we talk to our contractors all the time.
Not your contractors, but theirs. I think the question is, and I initially read that question that way, is will SAMHSA be reaching out to their partners and their subs?
No. I believe that, I don't think so. I think we would reach out to whoever the grant was awarded to, and then they'd be responsible for kind of ushering that information out.
Yeah, and then, but that is not to say, Randy, that your partners, your stakeholders, anyone within your system of care can also access technical assistance too. So we are always open to supporting everyone in your team, but we're not going to be questioning folks outside of the grantee.
Yeah, and then also, Denise, just to kind of add on to that, so Randy, in terms of like calls and stuff like that, like there's group calls, absolutely our contractors are welcome to, we encourage like group calls with all stakeholders, that are involved in operating the grant and so on and so forth. So yeah, like in terms of that, or if you're someone that you're contracted with had a question about a specific thing, they can certainly reach out to us as well. Like evaluators that are, contracted through my grantees will reach out to me with evaluation questions. Like that's totally fine too. So yeah, there's no like hard rules about we don't talk to your contractors. We can, but in terms of, I think, like getting, important information out, most likely the GPOs would most likely go to the project director, who would then be responsible for getting the information out to whoever it needs to get out within their own project. That makes sense.
I think it did. Thank you, Emily. So we're going to move on to Beth, who's going to provide some overview as to really a structure to help move you through your cooperative agreement, and I'm going to get you to your slide. And then as Beth is presenting, please continue to send questions in the chat box, and we will respond and pause for questions as well after Beth is finished presenting.
Okay, great. Thanks, Denise. What I'd like to do with you this afternoon is provide a context for your work and some of the premises for the expansion strategies that were specified in the FOA that you responded to. And then I'd like to spend some time talking about the lessons that we've learned so far around system of care expansion in states and communities, and how those can also inform the work that you're now embarking on. So you're all familiar, I think, with SAMHSA's theory of change. The idea being that if an intervention is demonstrated and then evaluated and tested, and the results have found that it is effective and that it achieves improvements both in service systems and improvements for children and families, and it's ready to go beyond the demonstration phase and move into what SAMHSA calls widespread adoption, which essentially is system of care expansion. And this all, as you probably are all familiar, evolved through the original Children's Mental Health Initiative System of Care Development Grants. Those were the 6-year grants that were started in 1993. And over a number of years, at 20 years, the evidence grew. The evidence base grew for systems of care. We saw system improvements and positive outcomes for children and families. And most recently, we've really been focusing a lot on return on investment and what cost savings can be derived from implementing the system of care approach in states and communities and across service systems. By shifting where dollars are spent, where investments are made from more restrictive and expensive settings like hospitals and residential treatment centers to an array of home and community-based services. And so based upon all this evidence, SAMHSA determined that system of care is ready for broad-based expansion, and that, of course, is that top ultimate objective on the theory of change, and that led to the Systemic Care Expansion Initiative, of which you're now a part. And you may also know that this started with one-year planning grants and then 4-year grants to do implementation of the plans. But starting in 2015, I think in recognition that expansion is a continuous process of planning and implementation. And so it was consolidated into a single type of 4-year grant with a 2-level approach, which I'll discuss in a moment. And the theory of change is really being implemented in this way through the cooperative agreements that you now have and are beginning to work on. One important point that I'd really like to emphasize is that system of care expansion is not a project. And I think it's important not to think about it as a project and not to think about it as a program and not to think about it as separate from all of the other work that's occurring in your state in mainstream service systems. The objective here is sustainable system change across the entire range of child-serving systems with the common goals of improving outcomes, improving service delivery, improving service systems. And also important to recognize, as I know a lot of you do, because you've already been undertaking a lot of this work, is that systemic care expansion occurs whether or not you have a federal grant. Certainly, having the grant gives you resources and technical assistance and some strategies that you can use to begin to leverage other resources to create the system change. But one of the things we like to say is that this grant really provides you with venture capital that you can use to achieve larger system change, to leverage other dollars, to bring other systems into the work to achieve common goals, and the importance of linking this with both mainstream systems and reforms that are occurring within them. So if there's one message that I really like to emphasize is that if you think about this as a project or a program, it really gets in the way of accomplishing what the major goal here is, and that's sustainable system change. Another point to make is that system of care is a complex intervention, and there have to be changes that occur at multiple levels, at the state level, tribal, territorial level, and also at the local system level, where you are actually implementing the system of care approach. But it's important to recognize that these changes also have to occur at the practice level, and that if you are working on system changes, you can't automatically expect that those will result in improved outcomes for children and families. They have to be accompanied by changes in the practice level to make sure that children and families receive excellent clinical interventions and that those practice changes combined with the system changes are what provide the positive outcomes. I know the diagram there is blocking it, but the notion is system change plus practice change equals improved outcomes, and those go hand in glove and really can't be separated in order for you to achieve your goal. We've taken a look since expansion work started as what kind of approaches states and tribes and communities have been using. And what we found is that there are a number of overall approaches, but most jurisdiction sites use a combination of these. Some are focusing on a geographic approach where sequentially additional counties or regions, communities are added as the expansion approach progresses. Some start with an age band initially, like early childhood or young adults in transition to adulthood, and ultimately work on expanding to broader other populations. Some grants have focused on a particular level of need, the most serious and complex conditions, children at risk for out-of-home placement, and the like. There are some sites that have focused on children who are eligible for Medicaid initially, and also maybe in a service sector, whether they want to focus initially on child welfare or juvenile justice. We have a few grants now that are looking at focusing on education systems primarily as well as a starting point. But again, most sites use a combination of these, and I think one of the things that's important as you embark on this is to think about your overall approach to expansion and how that will frame the work that you're doing, and also what your plans are over time to begin to move beyond those initial approaches and include more geographic regions, more age groups, more different levels of need, different service sectors, and so on. One of the things that helped to frame the system of care expansion effort when it was undertaken in 2011 was a study of effective expansion strategies, and through that we developed a framework that basically has 5 core strategy areas for system change that can achieve system of care expansion. It's important also to note that this framework really applies to the widespread expansion of any innovation or innovative approach in health and human services. But we use this to begin to think about how the system of care expansion grant program, the initiative, could be structured and what the requirements might be for state and community grantees. And it's organized into these 5 areas, all of which are represented in the FOA that you successfully responded to. And they include policy and partnership, services and supports, financing, training and workforce, strategic communications. And in each of those areas, there are quite a number of sub-strategies that were delineated, but the areas are all interrelated, they all overlap, and they don't happen in any particular succession. And I think states and communities have selected those that are most relevant to their particular goals. But this framework for expansion organizes the various activities and the various strategies that you're going to be using into these 5 main areas. I think you'll find that most of the work that's in your plans and most of the work that you have determined would be the strategies you're selecting to achieve those goals fall into these categories. I put a logic model here for you to look at, which I won't go over in detail, but I think it shows that this is a progressive process, although it is an iterative process, and they are, again, these various stages are linked, and you may go back and forth into various stages, but that resources are put in, state and community partnerships achieved, you do some planning, you implement your expansion strategies. And I really want to point out the outcome column here, because many of the outcome measures that will be looked at through the national evaluation and also through NOMS that you enter into the track system look at changes that happen at the state, tribal, territorial level, that look at community level changes where the implementation is occurring, and then also at the child and family level and what the benefits are to them. So partnerships, planning, implementation of strategies and outcomes is really the progression that we're trying to demonstrate in this logic model. The next few slides that I think you'll be able to look at afterwards provide a crosswalk of the expansion, and it should be FOA, not RFA, with the strategic framework that I just mentioned. And what we did here is take all of the required activities that were listed in the FOA and organize them into those core strategy areas. And so you can see that under policy, we pulled out the activities around governance, around family involvement at the system level, interagency work, and so on. And the next slides show each of the areas that, again, are addressed in the FOA and the activities that you're required to do, but organized in a way that may help you put a frame around what it is you're doing and see how they all interrelate. So here's the domain on service delivery, the one on financing, training, and generating support through strategic communications, or social marketing as we refer to it a lot. And this organization of the various requirements, we hope, will be helpful to you as you think about how you're organizing your strategies and how they can be applied to the specific goals that you've identified for your work. course, I want to mention that throughout all of your work, it's important to remember to infuse system of care values, the home and community-based, the family-driven, youth-guided, cultural competence, and interagency collaboration. And those should be reflected throughout all of the strategies that you're going to be implementing. So here's what I'd like to spend a little time on. We have spent over the last several years a lot of effort in trying to identify what we're learning so far about expansion and what lessons you can use to maximize the chances that your initiative to expand systems of care will be effective and achieve the results that you're looking for. And here are the few of them that I'll mention. There are more, but here are the few of them that I'd like to mention to you, and I will go through each one of them briefly. First of all, as I already said, it's not a project. It's not a program. Those don't sustain after your grant ends. System changes do. And the idea, of course, is not to have a 4-year grant that will go away at the end of the 4 years. But, again, the idea is to infuse the policies and the work that you do, the partnerships, the financing, into the mainstream system so that if your efforts are positioned and are defined as a way to make systemic and service delivery changes in the mainstream that can be maintained over the long term, you then are maximizing the chances that what you do will be maintained over time and won't go away at the end of the 4-year grant that you have. Another thing that we've looked at closely and talked with a lot of states and communities about is the importance of this bidirectional approach. And we've found over time that local efforts are not sufficient, that state-level efforts are not sufficient, but they are hand in glove. And local is where the implementation is occurring. System changes at the state level are needed to make the policy and financing and workforce and service changes that are needed to both expand much more broadly and to sustain those innovations. And that, of course, led to the changes in the System of Care expansion grants that I mentioned earlier. And as you know, state grantees have to identify communities for implementation and show how they're going to expand to other areas. Local areas have to demonstrate how they're working with the state for those higher levels of systemic changes. So the lesson here is to strengthen that bidirectional approach to system change. Now, I've shown you on this slide some of the roles of states and roles of communities that we've identified in our work. You can take a look at these, but you can see that a lot of the systemic changes are in the state column. A lot of the implementation changes are at the community column. And if you take a close look at these, you can get a summary of what we've heard from states and communities about their respective roles, and then how they mesh and how they dovetail with each other to achieve the goals statewide. Another lesson I'd like to mention is that there is no difference between implementation and sustainability. They're not separate. There's no disconnect. Nothing really should be implemented unless you have a way identified for sustaining it over time. And sustainability is more than financing. It's around the approach, the new services, better practice approaches. So it's the same, and all strategies that you implement really need to look at both how you're going to implement it and how you're going to sustain it over time. I also mentioned this briefly, but this is a huge lesson. The grants are venture capital. I think it's incumbent on you to demonstrate that you have good data on the outcomes and on return on investment so that you can make the case for investment in system of care expansion, and that you can use this work, the grants and the money provided through it, to create those system changes, to work with other child-serving systems, to modify what financing streams will pay for, and to get commitments from your partner systems around redirecting funds to better and more cost-effective approaches to providing services. So venture capital. Another one is that we all talk about family and youth driven, and it is, of course, a basic and core value of system of care, the whole notion of nothing about us without us. And family and youth voice is essential at all levels. I know you're aware of that. We have found that family and youth organizations are good vehicles to provide a collective voice for families and youth at all of those levels. And I'm sure you're familiar with Youth Move and FREDLA, the Family-Run Executive Directors Leadership Association, and the Federation and NAMI. And, you know, it's important to engage them in your work and also understand that families and youth fulfill a lot of critical roles. And I included also a slide here for you to look at about what the roles are at state and local levels, at the system level for family organizations and family leaders, and also what some of the roles are at the child and family level. This resulted from a project we just finished, interviewing both state system leaders around systems of care and also family organizations about the work they're doing and what impact they think that it has had. Briefly to mention the core services, I know you're all familiar with the joint bulletin that was issued by SAMHSA and CMS. And these are the core services that are in the bulletin. Many of the grantees that we've been working with have focused on these core services in addition to the larger list of services that are in the FOA. But these core services are one that have become particularly important and that sites have been focusing on, I think, pretty intensively. And this work doesn't take place in a vacuum. There are many other things occurring in your states, whether it's Medicaid reform or managed care or behavioral health primary care integration and all of these others. So having your reforms and your system changes occurring apart from other things that are occurring in your states and in your communities will, again, not ensure sustainability over the long term, but ensuring that you leverage, that you link with, that you work toward the common goals in the context in which you're functioning. And finally, strategic communications we found is a real key for success. And I think when we think of social marketing or strategic communications, we often think of public education campaigns around stigma or increasing awareness. But it's really more than that. And it really is focused, I think, as in one very important aspect on generating support among the high-level policymakers and decision makers in your sites. Those are the people who will determine how resources are allocated, how funds are invested, what approaches should be adopted, and using data, especially that return on investment data, to make the case for system of care expansion is something that will also feed into your efforts to not have this be a 4-year project, but something that will help to make those systemic changes that will last into the future, which, of course, are the goals. I just wanted to show you this pyramid of system change, which is another way of looking at the logic model and shows that mission, system changes, infrastructure services, positive outcomes and return on investment, and then expanding and sustaining is a way of thinking about what it is that you're trying to do. Win-win scenarios. This is a case you can make your systems in your states and communities that system of care implementation provides benefits and provides cost savings to all of the systems that will be your partners and that you will be working with. So with that, let me end and pass this on to Denise, who will be talking about the resources that we will offer through the TA network to support your work. We also have a number of resources around what I have mentioned previously, and we're happy to answer questions or have individual conversations with you about that if there are any areas you'd like to discuss any further. So Denise.
Thank you. Thanks, Beth. As I said, it's pretty difficult to read about systems of care without seeing Beth's name right there. I love working with her and supporting all of you.
Oh,
so
well,
thank you. There's a few more questions that came in. Emily, there was a question about the behavioral health disparity impact statements and who they should be submitted to. I did type in the chat box that they go to the GPOs, but we probably should go over that all of the deliverables go to your GPO. That's the financing plan, the social marketing, strategic communication plan. Do you have anything else to add on that, Emily?
Yeah, no, you want to make sure that exactly what you said, Denise. Everything should be going through the GPO.
And it is confusing because, especially the new grantee, you have all these different people emailing, talking at you, talking with you. So the technical assistance support contractors are here to help you develop your deliverables, but ultimate approval and submission goes to and from your GPO. There was another question about the report template for the progress reports. I did type in the box that SAMHSA does have a template that's available through the GPOs. I don't know, Emily, if that template is in the process of being changed this year or not.
Yeah, it will be, I guess, probably updated a bit. But yeah, it's not ready yet. But that will be something that would be sent out to grantees from the GPO.
Great. And then there was a question about the logic model, Beth, and whether or not this is a required submission, and that the old CMHI program, as we used to call it, the 6-year agreements, used to have the requirement that logic models be submitted to the GPOs as part of a deliverable, a grant deliverable. They're no longer required, but I still believe that they do help move your system of care forward. And Beth, I don't know if you want to say anything further about that.
Yes. We have had a couple of inquiries about logic models, and we are trying to work on getting a webinar ready for any sites that are interested in learning how to do a logic model that can be a real document that is not just on paper, but that can help define your work and the outcomes you want to achieve. So we're looking at a webinar on that. However, at the same time, if there is a site that is particularly interested in working on this, and one site has already expressed some interest in doing that, we do have the possibility of getting some expert consultation with you, for you, on how to accomplish that. And if you would get in touch with me, I can try to link you with some of the expert consultants we have around logic modeling. And maybe if there's enough interest, we can arrange a little small group consultation via conference call or webinar on that.
Great. Thank you, Beth. And then finally, Emily, Randy did clarify his question. And his question was the one about SAMHSA making contact with contractors. In this case, he is a contractor or subcontractor for a system of care grant, and at times he's asked to communicate with the GPO or Gwen, and he's just asking if that's permissible for a contractor to have direct contact with SAMHSA.
Yes, it is.
PD is asking. Okay, great. Thank you. All right. Well, I'm going to hop into what the National Technical Assistance, the National TA Center has offered for you, and I'm seeing a lot of names that I recognize, so forgive me if you've been on calls with me and you've already heard me say this, or one of your lead consultants already gone through all this, so I'll go through quickly and allow us time for additional questions if necessary. So the TA Center is developed through a partnership. While I am a deputy director at the University of Maryland, University of Maryland is a hub for a whole network of partners to support you. And there's all great logos. So the partnership includes the Institute for Innovation and Implementation, that's us at the University of Maryland. We also partner with Case Western Reserve University, that's Rick Schlepler. They do a lot of co-occurring substance use work. We also work with them on Centers of Excellence. The Center for Healthcare Strategies, that's Kamala Allen and colleagues. They do a lot of financing policy work. They do a lot of work for SAMHSA as well as the Center for Medicare and Medicaid Services. Beth mentioned the Family-Run Executive Director Leadership Association, that's FREDLA. The executive director there is Jane Walker, and we do a lot of work with her and her colleagues, and they run our family leadership and engagement work, and they have a learning community that some of your colleagues may be interested in joining. We also partner with Georgetown University Center for Child and Human Development and they are leading all of our early childhood work. So any of you that have early childhood system of care grants, you're probably working with Neil Horan. We also partner with the Human Services Collaborative, more commonly known as Sheila Pires, also a very familiar name with systems of care. Management and Training Innovations, that is Bestrol. The National Indian Child Welfare Association, NICWA, that is, they do all of the work with our tribal grantees. They also do work with non-tribal grantees, especially states that are engaging in system of care expansion within their tribal communities. They are led by Terry Cross, as well as Corey and others there. Tufts Medical Center is another partner. That's something new and different to, I think, this TA approach. We have Dr. Christopher Balanci. We call him our medical director for the TA Center, and he does a lot of our clinical distance learning series work that I'll talk about in a few minutes. We also partner with the Policy Research Associates, that's PRA. They're home to the National Center for Mental Health and Juvenile Justice. That's Carly Cater and Jackie Green, and they have been connecting with system of care grant sites that have specific juvenile justice focus, as well as working with populations that are serving co-committed populations between juvenile justice and child welfare. Portland State University, that's Janet Walker and colleagues. They, along with the University of Washington, co-lead the National Wraparound Initiative. Also at the University of Washington, we have Eric Bruns and his colleagues. We also have the University of South Florida is one of our partners, and they lead our cultural linguistic competency work, and they host the annual research conference each year in March. And finally, last but not least, Youth Move National, motivating others through voices of experience. They are our youth engagement and leadership voice, and Johanna and her colleagues, Primacelli, do a great job in that work. And they have a couple different learning opportunities and communities available for youth, young adults, and those of you that are looking to develop youth organizations in your communities. So the NTAC, the National Technical Assistance Center, is under this contract, we pulled together, or SAMHSA pulled together, 3 different contracts, which now forms a single TA center that falls under the entire umbrella of the TA network. So we provide technical assistance to you, grantees. We also provide training and technical assistance to states and communities without system of care grants. And we also do the logistics work as far as site visits, setting up meetings, and that type of work. So what we did when we pulled together the TA network, many of us were in your shoes, and we were responsible for implementing significant change through system of care grants, through other work, and so we were convinced that there was no single technical assistance person sitting in an office somewhere that could satisfy all the needs that you have in dealing with these very complex grants and systems change. So what we did is we developed a network of partners, and we operate very much like a wraparound plan of care, where you have a care coordinator facilitating, identifying the needs of the child and family team, the strengths of the child and family team, and helping you put together a plan of care for your community. So that's what we do. We work with you, and I'll talk about our different roles in a minute, but our goal is to be as flexible as possible and bring to you diverse experiences and perspectives. So just because you have a lead consultant assigned to your grantee, that does not mean that it's the only person within the network who you have access to. So I said we try to ground ourselves in real-world examples. All of our staff and partners, as I said, have been there where you are right now. We have experience in actually writing the regs, writing the state plan amendments, writing those financing plans, writing and pulling all of those pieces together, but more importantly, also once they're written, taking it to the next step to implementation. So we're there and we draw upon that expertise. We do encourage the family and youth partnership, the cultural and linguistic competency, and of course everything that we do, we try to embed within system of care practice and principles and delivering them into the mainstream delivery systems. So the TA network key roles, those of you who have already had calls with your GPOs and your lead consultants and hopefully your social marketing and evaluation leads, you were most likely contacted by a technical assistance support coordinator with the TA network. They are assigned to you to help coordinate your TA, to help get you prompt responses, whether or not you're a grantee or a non-grantee, and to assist with drafting documents. They help pull down resources for us. Each of you has been assigned a lead consultant, and it's our job to really help identify what your needs are and pull from within our network, as I said before. We're available for regular calls, but if that's not your thing, if you guys are moving at a fast pace and would prefer not to have monthly calls, we're not requiring that that happen. Some grantees, especially some of you who may be on your second or third cooperative agreement, would prefer to have email communications and calls as needed. Many of you rely upon a rapid response mechanism that we have that I'll talk about in a minute. But basically, we're here not to be a burden, but to be a support. So use us as much or as often as you would like. Your lead consultants were assigned to you based upon both their knowledge of work going on in your state and the focus that you identified in your application narrative. And you will have the opportunity to swap out lead consultants as you move through your grant program. Finally, we also have content experts, and that's where I was saying before. Think of your lead consultant as being your wraparound care coordinator and identifying different experts that you may need to pull into your team to identify needs, to help really also work on your strengths and then disseminate those strengths to other grantees through peer-to-peer learning opportunities. So content experts are specific subject matter experts that we can pull in through site visits. We are able to do some site visits with folks, also available for TA calls, webinars, and actually email communication as well. So we have different types or levels of technical assistance. We have the weekly TA telegram. A couple times I've referenced the TA telegram as comes out on Mondays. That's where you'll see the latest meetings that are coming out, training opportunities, resources that are available. We send out notices from SAMHSA for you on those as well. We also have monthly minutes. Those are animated shorts. We're learning that sometimes folks, as much as it may be fun to get on the call in the afternoon with us for an hour and a half for a webinar, sometimes methods of learning are more fast-paced, and so we have some animated monthly minute shorts that are fun to share with community members, as well as we're working on podcasts and other distance learning opportunities. And we also disseminate resources and different publications. The next level is individualized, and that's where I said we have lead consultants working with you and available to support you as needed. And this is where we also have the rapid response TA mechanism. So you may have a question, say, for instance, you are looking for some job descriptions for family lead and youth lead. We had a couple communities ask for them. So when we get that request, we reach out to our network. Fredla and Youth Move National worked across communities, pulled together some job descriptions, and then we were able to disseminate. Sometimes you'd have a question about what are other states using for peer support, Medicaid rates, what has been approved. We would get that question, we would disseminate it, and send it back out to you. So that's a mechanism for you to get resources as quickly as we're able to gather them without you having to wait for or request regular calls. And finally, the last level of technical assistance, the highest level, is the customized approach. So that's where we're looking to work with you to accelerate your ability to advance your system of care expansion and sustainability. We do this through on-site TA. We also do it through peer exchange. Our friends in Oklahoma with their rural crisis response approaches have been tapped on several times recently. I'm seeing them in the emails. And that's another way to use this learning community as well, is to match you up with similarly situated grantees, PIs, PDs, social marketers, evaluators that are similarly situated, and match you up with peer-to-peer learning, whether that's in person or virtual. And then finally, we do offer some trainings and meetings on specific content areas, and I'll get to that in a second. So the dissemination approaches, again, is just our weekly telegram. We do have our webinars, office hours. Sometimes we'll have just calls just to discuss after you've digested a webinar. This is an Ask the Expert type of opportunity. We have learning communities, we have resources, and we have meetings and trainings. Our resources come out in the form of issue briefs, sometimes reports, sometimes frequently asked questions, as well as TA tools or tip sheets. I mentioned we have some topical learning series and communities. So this is where different stakeholders within your communities may want to join our cultural and linguistic competency learning community. We also have one on family leadership, youth leadership. In fact, Johanna and Youth Move National have a couple different learning communities within their network. The System of Care Expansion Leadership Learning Community, that's us, Beth and I. Tribal Systems of Care, Clinical Best Practices, and I'll talk about that in a minute. We have a learning community on early psychosis. We have a learning community on Centers of Excellence. That's a way that a lot of states work on developing and sustaining their own training and technical assistance capacity. There's co-occurring substance use, early childhood, juvenile justice and systems of care led by our friends at PRA. And in development right now is a rural learning community and a transition age youth learning community. And what's really fun about the transition age youth learning community is that we're partnering with our colleagues who run the Technical Assistance Center for the Now It's a Time Healthy Transition grantees, so that we're pulling together grantees from 2 different programs into a single learning community. So those of you that have a population of focused on transition age youth or older adolescents, this may be a learning opportunity for you to find out not only what your colleagues are doing in system of care grant situations, but also in the Healthy Transitions Grant Program. We talked about the Behavioral Health Disparities Impact Statement. That is your first deliverable due, and it's due by the end of November. I believe that the date was November 30th. We did have a learning community on, a webinar on how to develop a Behavioral Health Disparity Impact Statement October 13th. The link to that is available on your screen, and you will get the slides to this presentation. If you need one-on-one assistance or additional resources, you can contact Linda Caes or Peter Gamache, and we have their email information. And what they're really trying to do is not only to help you develop a Behavioral Health Disparity Impact Statement to meet your grant objectives, but also to have one that's able to help you use that statement, to use the data, the research and evaluation to identify the segments of your communities that are underserved and help develop strategies to better serve those populations, looking at your social, economic, environmental factors, and having it a living document that could be rolled into your strategic plan, that could be rolled into your financing plan. So we're really, while the statements are to be submitted to your GPOs, we are really interested in helping you develop quality statements. The Clinical Distance Learning Series is something new that the TA Network started. They're short pre-recorded clinical webinars. This is where a lot of you are really rolling out complex service delivery systems, new services, working with Medicaid waivers, Medicaid state plans. This is where your providers can join us on what are the best practices out there. How do you best serve certain populations? So our upcoming topics include early onset psychosis, co-occurring substance use and mental health, early childhood, intellectual and developmental disabilities and co-occurring with mental health needs. So this is a great opportunity for you to really engage your provider community as well. And these are all, again, highlighted in our weekly telegram. I just put out an example of some of the TA Network resources that are available for you. We do have a link. Examples of tools that we have out there include how to become a Medicaid provider, peer support. Beth Struhl worked on that with Fredla. Just demonstrating effectiveness with wraparound. We have a lot of wraparound resources. The University of Maryland, in partnership with University of Washington and Portland State, together they form the National Wraparound Implementation Center. So you have experts that you can access through the TA Network to answer questions, although we can't do the coaching and supervision that's usually needed with high-fidelity wraparound implementation. We can answer questions and help set you on the path. We also have evidence-informed practice in systems of care, implementing treatments for youth with co-occurring, and I won't keep reading the list to you, but there are a lot of resources, and again, as they come out, we do put them in the telegram. Few others, intensive care coordination using wraparound. We have 3 mini briefs on care coordination, rates and billing structures, supervisor to care coordinated ratios. A lot on financing tools for systems of care. These come in very handy when pulling together your financing plan. And Beth and I will be hosting later this fiscal year a webinar specifically on developing a financing plan, and Sheila Pires will be joining us on that one. Finally, we also have, not finally, but just as a final example, services and supportive community living for the youth with serious behavioral health challenges. And this is where we're taking the May 2013 joint information bulletin that was in your funding opportunity announcement that was put out by SAMHSA and CMS together, where they identified services that do work for children and encourage you to incorporate them into your Medicaid plans and state plan amendments. And we have one out on respite care, intensive in-home services, mobile crisis response and stabilization, and customized goods and services. So this goes a little bit deeper into what do those services mean, but more importantly, how have other states implemented them? What does it look like in a state plan? And then more importantly, in my opinion, what does it look like as far as implementation is concerned? So we talked about meetings and peer learning opportunities. The USF conference, as I mentioned, is coming up in March. That is a great opportunity for you to send a team of folks to learn. There will be, I believe, I wish I had Johanna on the phone with me, I believe there is going to be a youth track this year. Beth, do you know if there's a youth track specifically planned this year at USF?
Oh, I'm sorry, I was in mute.
You were on mute, that's what I thought.
When the youth track is going to be doing their evaluation training,
is
involving
there
youth and evaluation?
Are they having
tomorrow.
a track?
Is that what you're talking about?
No. Is there going to be a youth track at USF this year is my question.
I'm not sure about that.
Okay, we can follow up. But anyways, that annual training, the annual research conference in Tampa in March each year is always approved by SAMHSA as a meeting that meets the meeting requirement. We will also be having mobile response and stabilization services a meeting. This is a peer-to-peer learning. We offered this once last spring. It was very successful. We held that in New Jersey, where Connecticut as well as wraparound Milwaukee and New Jersey present together. In order to participate in this meeting, we're limited in the number of people who can come or number of teams, so there is an application process. The December meeting is full. However, we will be putting out another application for a third meeting to be held the week of April 17th. And again, that will be going out in the Telegram, or you could always ask your lead consultant about this opportunity. We also have a very interesting, new, and exciting meeting that's going to be open to the public. It means you don't have to apply. It's open registration. It's going to be the Family Acceptance Project. And for those of you that don't know what that is, the Family Acceptance Project is about providing a peer learning opportunity with expert facilitation on the critical role of family support for LGBT children and youth, and informing and providing participants with the tools they need to address the needs of LGBTQ youth in their systems of care with very much a family focus. So that is going to be held in Detroit. Caitlin Ryan is the founder of Family Acceptance Project, and that meeting is being co-hosted by our Cultural and Linguistic Competency folks as well as our Family Engagement Leadership team. The Tribal Grantee meeting this coming year in April is going to be held in San Diego, California. That's open to all tribal grantees. New this year, we are going to have a grantee meeting. We haven't been able to have any of those the past couple of years. This is not the big system of care training institutes. This instead, although we're hoping to do that in at the summer of 2018, this one is about really open to CMHI grantees. It's really focused on grantees, both new and grants that have been going for a few years but may still have staff and stakeholders that are not completely familiar with system of care practices and principles and the way to fully implement systems reform. So that meeting is going to be open to CMHI grantees. We're going to have a limited number because we're limited in size. We can only have 300 participants total. The project directors and principal investigators will be able to submit a number of participants per grantee site, and then we'll be able to go to a wait list. And there'll be more information coming on that. Finally, the opportunity that we have in planning right now is Innovations in Medicaid Managed Care. And this is where this will be our third offering. We've offered it twice before. The meeting will be held in Rockville in July. It will be an application process, and this is an opportunity for you to bring together a team that's really working deeply on financing and pulling together a Medicaid a Medicaid plan, or if you say you're about to roll out a Medicaid state plan amendment, or you're looking at managed care and how integration is working with your state, and whether or not, and to what extent, and how can you best develop a specialized delivery system for children with behavioral health needs within a Medicaid managed care environment, then that learning community or that learning opportunity is the one for you. And again, as these come up, we'll continue to put them in the Telegram. We also wanted to just highlight for you that in addition to our partners, and you saw the big list and all their logos, we also do work with the National Association of Deans and Directors, with the Schools of Social Work, where we're looking to help develop curriculum for SSW students so that when they come out into the field, they are familiar with systemic care concepts, best practices, and moving systems forward from a practice level for children and youth in our communities. We also partner with the American Psychological Association, the National Council of Behavioral Health, Open Table, which is a movement where it's pulling together. It's a faith movement. It's not a registration for dinner, a reservation for dinner. Open Table is a great faith-based initiative where you pull together a team of brothers and sisters who are working to help, whether it's a foster care youth or a family that's coming out of wraparound. Say your family has reached a period of resiliency where they're graduating from the wraparound care coordination table, but still they may have significant issues as far as being able to pay their bills or have a home to live in. Open Table is a great way to partner with your faith community to develop resources and a support network for those families. So if you want more information on Open Table, I'd be happy to provide it, as well as Building Bridges Initiative. It's Beth Caldwell and colleagues who work with residential treatment providers and moving that service delivery, recognizing there is a need for residential treatment, but more importantly, our focus is on developing the resources in the community and the transition of those youth back into the community, and working with families doing so. So if you've been on the phone with me, I've encouraged you to please complete an online profile with our TA reporting system. As I said before in response to Randy's question, you do not have to be the formal grantee in order to receive technical assistance from us. We want to be able to help you as much as possible. But what we're asking is that you register with us by going online, submitting a profile so that we can find you in our system, because part of our CQI efforts is we send out surveys every quarter asking you how we did. So we want to help you, but we also want you to tell us where we're strong, where we need to develop, and more importantly, where the needs are. We also have a state, tribe, and community information exchange. Any of you from prior to 2014-15 grants know about this. We send this out annually. We'll be sending it out in January. And this is a web-based mechanism for us to exchange some information to learn more as you've now gotten your feet wet, you're 6 months into your cooperative agreement. Have your needs shifted? Do you have new areas of focus where you need further technical assistance? Do you have suggestions for the field as a whole? We're going to use these information exchanges to reevaluate. Sheila Pires and I work on assigning the TA leads to each of the states and grantees. So we use this to help make sure that we're matching, making the best match within our network to meet your needs. I should also say that in addition to our partners that I listed, we also have a very robust consultant pool. And we can pull from that consultant pool to match experts up to your needs as well. For example, Bruce Camrett is one of our lead consultants. Although he wasn't listed on the slide there, he's doing a lot of work with our grantees. I think I've said weekly telegram about 18 times, but here's a slide on this. If you're not receiving the telegram, please consider sending an email to the TA network at that email address with subscribe in the subject line, and we'd be happy to set you up. Mentioned the Systemic Care Expansion Leadership Group. So as we have resources, we're going to post them to this email address or to this link. It's not an email address, it's a web link. And among other resources that we mentioned today, the slide deck for this webinar is actually already posted up there on that site. And we'll also be sending you out the slides as well as the recording. So everyone that's registered will be receiving an email from me within the next week or so, except for that we do have the Thanksgiving holiday. You will be receiving an email with the link and the PowerPoint slides. And this is another plug for our learning community. If you have other members who would like to join the Systemic Care Leadership Listserv, many of you probably are not part of this. This is your opportunity to then communicate with us, communicate with others, and we would encourage you to sign up because while we do what we can to address your needs and identify areas where we think we can bring some experts to you, many of the experts in the field are your peers that are doing the same job as you are day in, day out. So this is an opportunity for you to connect with one another and share resources. Our next learning community is going to be on December 7th. It's a week ahead of time due to the holidays. Normally we're at the third Wednesday of each month. It's going to be from 2:30 to 4 o'clock, same time as this one, Eastern time. And this one is going to be a review and question and answer on national evaluation, where we'll have our partners, both Abram and Jessica from WestStat, join us to answer some questions and to give you an overview. Here's some TA Network contacts. Michelle Zabel is the director of the TA Network. Marlene Matarese and myself, we are the deputy directors. Your TA support coordinators, who should be reached out to you already and set up calls, are listed there. And the bottom line is, if you don't know who to contact, you can send an email to the TA Network at ssw.umaryland.edu, and we would be happy to assist you. So I just did a lot of talking, and I saw a lot of activity in the chat box. Beth, what's been going on the chat box while I've been chatting?
Well, I think we've a couple of really good issues have been raised, and I think we've responded to them. One of them is around a TA in social marketing and strategic communications. And Tim, thank you for clarifying
Hi,
that
Tim.
the campaign is the name of the TA team that'll will work with you on communications. And one of them should be on your initial call. Some of you have had those calls and some not. But they are available for individualized TA, and we can certainly suggest the possibility of some kind of learning community that might be created for that. And I just wanted to throw in also that is relevant to our next meeting in December, that we are working very closely with the evaluation team for the national evaluation. We actually have a work group that we've created to coordinate the evaluation with TA, so that we're all on the same page, that we work together, that we know what issues you've raised with us and what issues they've raised that have implications for the evaluation and for TA. So we're both working to try to help clarify some of those things as you move into the evaluation. And also wanted to point out that Abram Rosenblatt from WestStat is the director of the national evaluation. The other person on there is Jessica Taylor, who is working on the track system at WestStat. So in addition to the evaluation, she'll be available to answer some of your questions around NOMS and entering that into track. And we will talk about the differences between those two systems, how there's been a tremendous effort to try to streamline that and implement them in a way that's less burdensome to you. So I really recommend that all of you consider being on that December 17th learning community.
That's great, Beth, and it is timely. As Emily mentioned in her presentation, service delivery is supposed to start at the 6-month mark, and so what you do want to do is think carefully through what's your entry point into your service delivery, who's going to be conducting the interviews, both the NOMS and the national evaluation interviews, and how are you entering that data. So it's good to have all of those checks done in next month, and actually just in a few weeks in December. Emily actually does a very good job. I've been on several phone calls with Emily, and she does describe the TA support that's provided to you through a 3-leg stool. So you have the TA network, which is broad-based general technical assistance covering an array of subject matter. And then you have the campaign for children's mental health, which is, as Tim indicated, the social marketing communication TA, and you have a TA lead from the campaign assigned to you. And then the third leg is your national evaluation liaison. And together, the three of us for each of your grant communities work together to support your needs. So sometimes you're going to have a TA response coming just from one of the partners, and sometimes we all pull together. A great example of that, and I'm not sure if I have anyone from New York on the line today, but Chautauqua, New York hosted a peer learning opportunity in September that looked at how do you use data from evaluation to put it into your social marketing and communication plan, and how do you then use that to further sustain and expand your system of care. So the TA network was able to come together with the campaign and with WestStat to pull together expertise and support Chautauqua in hosting a meeting that other grantees came to. So again, it's a great example of relying upon the peer-to-peer opportunities, but at the same time relying upon the three different hubs of technical assistance available to you as grantees. So we are exactly at 4 o'clock, 4:01, and time's up. Thank you so much for joining us. Emily, do you have any last words over there at SAMHSA?
Thank you, everyone, for joining us. Denise, this was very productive. Thank you so much.
Thank you. All right, Beth and I hope all of you join us in a few weeks on December 7th. Thanks a bunch.